Hello, today we're going to go through the basics of Medicare. My name is John. I'm president of Riley and Associates. We are a local independent insurance agency. We specialize exclusively in Medicare, and we've been in the health insurance space for over 2 decades. Today, I'm going to take you through much of what we do with our clients through the first personalized presentation. We're not going to be specific on recommendations, but we'll go through the basics of Medicare. We'll go through your two options and then the services we provide. Our goal is to keep it real simple, but there is a lot of rules and details and deadlines with Medicare. So we're going to be covering quite a bit today, and hopefully we can answer all of your questions. So what is Medicare? Well, Medicare is health insurance provided by the federal government for those that are age 65 and older, and those under 65 with certain disabilities. Most people are eligible for Medicare as long as they're 65 and they've paid into, or a spouse has paid into the program for 10 years or 40 quarters. So Medicare actually has 4 parts to it. At the moment, we're just going to look at Part A and Part B, which is known as Original Medicare. Okay, everyone must sign up for Original Medicare. You sign up 2 to 3 months prior to turning 65, or when you retire, coming off a large group plan. So Part A is your hospital insurance. Let me get my pointer going here. So Part A is your hospital insurance, and Part A covers inpatient stays and skilled nursing. Part B is your medical insurance. This covers things like doctor visits, labs, x-rays, diagnostics, and outpatient surgery. Together, they're known as Original Medicare. Now, Part A is usually free for most people as long as you or a spouse has paid into the Medicare system for 10 years or 40 quarters. Part B comes with a premium, however. With Part B, you've got a premium of $202.90 in 2026, and it is increased, adjusted up based on your income. So if you're in a higher income bracket, and we'll take a look at that chart in just a little bit, you'll see that you'll be paying a little bit more for your Part B premium, but most people will be at $202.90. So now that we've looked at Original Medicare, Part A and Part B, we'll take a look at all 4 parts here. So Part A, again, that's your hospital insurance. It covers inpatient stays, skilled nursing. Part B is your medical insurance covering doctor visits, labs, x-rays, diagnostics. And they're known, Part A and Part B is known as Original Medicare. Everyone needs to sign up for Original Medicare. And then you're either going to get a Part C plan, which is known as an Advantage plan, and it operates just like an HMO. And so you can get your coverage there, or and then there's also Part D, which covers a prescription drug. And so we'll take a look at how these work together, okay? Really, you're gonna find that you're only gonna have 2 options. You're gonna have Part A and Part B, which is Original Medicare. You're gonna get a supplemental or gap plus a Part D, and that will be kind of like a PPO version. The other one is you'll get an Advantage, which covers Part A, Part B, and D inside it and works like an HMO. So we're going to talk about your 2 options all throughout. So just to give you an idea, but before we go any further, let me suggest, just especially for those of you that aren't planners, that we set up a discovery call. Setting up a discovery call 3 months in advance before you turn 65 or before you move off a large group employer plan is super important. You don't want to miss that step because there's a lot of deadlines. And so during this call, we determine the schedule. We set up a schedule for you as far as your timeline when you're going to sign up for Original Medicare. We'll talk about your doctors and medications and things like that, your general information, and then we'll take a look if you've got group coverage. We can compare your costs and your benefits. We go through and determine the type of coverage that you most likely will go forward with, and then we'll set up a schedule of reminders leading up to enrollment in Medicare and your enrollment in whatever plan you decide to cover those excess costs. Okay, so that's how that all works. Now, just as kind of as like an FYI, and for most of you, it probably is too late at this point, but really recommend a discovery call like at age 62 or 63. And the reason I say that is, just working with a lot of clients, there a lot of times people will be surprised at their Part B premium, and we'll take a look at that in a little bit. But as I mentioned, it's adjusted up for income. So you can actually at age 62 meet with a Medicare agent like myself, and then maybe a financial advisor and CPA. And there's strategies that you can put in place to lower your income so that when you do retire, you're not paying a real high Part B premium. So if you want any information on that, we've got like a checklist and a video that gives you details, and you can just click the link below and we can send you that information. Okay, but yeah, it might be too late, but you might know someone. All right, so this is really important stuff, and people miss this stuff, and you just need to know. So there's 3 main enrollment periods that you're going to need to understand at this point, and then a couple which I'll tell you about. The first one is your initial enrollment period here. Your initial enrollment period is when you're going to go ahead and enroll in original Medicare Part A and Part B. And once you enroll, it will start on the first day of your birthday month, okay? So let's say that your birthday is here in, say this is January, February, March, and April. So your birthday month is in April, for example. You're gonna have a discovery call. You're gonna enroll in Medicare Part A and Part B. 3 months, you have 3 months prior to your birthday month, the month of, and 3 months after. Ideally, you want to do it out here, and then your coverage is going to start the first day of your birthday month. And if working with us, you'll figure out what other plan you're going to have, and that will kick in on the same day. Okay, so just good stuff to know. Also, if your birthday is on the first day of the month, then your enrollment date is going to be the first month of the month prior to that. So instead of being on your birthday month, this, say for example, in this, it would be in March 1. So of course we help you with that and get that scheduled out, but just so you know, okay. So a little bit different if you have a birthday on the first of the month. The next area we're going to look at here is your supplemental enrollment period. And with this enrollment period, this goes into effect at the same time, the first day of your birthday month. So that's when Part B would go effective. And you have a 6-month window, which you can go ahead and enroll in a supplemental. A supplemental is going to be what I'm going to call option 1, and that's going to cover the out-of-pocket expenses that original Medicare doesn't cover. And so when you first sign up for original Medicare, or when you first sign up for Part B, so say maybe you delayed because you're with an large group employer plan, but when Part B goes effective, then you've got a 6-month window, which is a guaranteed issue, meaning they can't deny you for health reasons. So it's really important to understand that. That will be one option that we'll talk about during the discovery call. And the second one is going to be your Advantage Plan Part C, which we'll look at, which will also cover, the out-of-pocket costs. It's just a different way. It works more like an HMO. So you've got 2 different options, which we'll look at. The next enrollment period to look at here is your annual enrollment period. And this runs from October 15th through December 7th each year. And it's just your time to set up a kind of a review and take a look if any medications changed or any doctors changed, just to make sure that coming into the new year, you don't have any surprises right? For example, if a formulary that you're taking is no longer on that plan, so you would need to make that adjustment. So we have a process for that, and we get you prepared well in advance so that if you do need to make any changes, you know what to do, and we help you with that. Okay. So the next enrollment period here is what we call the open enrollment period. And that's for somebody that's already on a Medicare Advantage plan, which is your option 2, again, which we'll take a look at. And that works like an HMO. But if you're on a Medicare Advantage plan, and say, for example, you miss this annual enrollment period and you still need to make a change, you could make that change and go to a different Advantage plan in the first 3 months of the year. That's called the open enrollment period. And you can also disenroll from an Advantage plan and go back to original Medicare, which will provide additional options. So that's something to know about. And again, if you're working with us, there's no surprises. We work with you on the annual enrollment period, and then sometimes clients will need to make a change in the first of the year, and we can do that with them, okay, for them. And then the last area is called the general enrollment period. And this general enrollment period here, that's for those that missed their initial enrollment period, right? So generally they're going to pay a late penalty, which they'll pay for life to Social Security, and they'll probably have a coverage gap. And then they'll enroll in the first 3 months of the year. So you don't want to do that. That's why you want to have a discovery call and make sure that we get everything planned out and your ducks in a row. Okay. All right. So let's look at original Medicare Part A and Part B. These are some of the out-of-pocket costs that Medicare does not cover. That we'll look at the 2 options, different ways that you can cover those out-of-pocket costs. Okay. So you've got some deductibles. You have a deductible with Part A, which is $1,736 here in 2026, and that adjusts a little bit each year. Most of these numbers do adjust. The 20% has not adjusted. But, you've got a deductible of $1,736, and that's on a per incident basis. So say, for example, you're hospitalized, and then you come out of the hospital, and then past 60 days, you're out for 60 days or more, and you go back into the hospital, they can charge you this again. So it's just important to note. So that's one of the reasons you get either a supplemental or you get an Advantage plan to cover these out-of-pocket costs. So that would be covered as well. You have a copay here if you're in a skilled nursing past 60 days. You have a deductible here. Now, this is an annual deductible for Part B of $283, and that will adjust a little bit each year as well. And the $283, that's the only part that's not covered under a supplemental. So option 1, you're going to get a supplemental to cover these costs, which we'll go into. And option 2 is an Advantage plan, and it will cover this cost. But the supplemental, you're going to pay the $283 at the beginning of the year for whatever services you're getting under the medical insurance. So it might be doctors, it might be labs, a combination of it. And then after that, then the supplemental plan and Medicare pick up everything. Okay, so these are the out-of-pocket costs that we're going to pick up. And again, we're going to have 2 options to do that, and I'll make it real clear as we continue on. Okay. All right, so I had mentioned that for Part B, there was a premium of $202.90 for 2026. And this adjusts a little bit each year, but this is the chart for 2026. So they're going to take it based on your income for 2 years prior to turning 65. So they're going to take a look at when you sign up. Originally, the first bill is going to be $202.90 times 3. They bill you for the first quarter. So you're going to be about $609 or so for that first quarter. Now, if you're in a higher income bracket, and they look at your tax return from 2 years prior to determine what that will be, then you will get a second bill from them for 3 months for what's called IRMA, your income related monthly adjustment amount, based on your income. So if you paid the $202.90 for the 3 months, and then you're going to get another bill for the difference between this and the bracket that you're in. Okay, so say for example you were in this bracket, you're going to get an additional bill for $203 times 3, and that will make up this. That will be your monthly Part B premium. Okay, so just to know, if your most recent tax return was lower, in a lower bracket, then we can help you with that. You can file an appeal, and the Social Security will take a look at that, and hopefully they'll adjust that down for you. But just so you know, that's the way it works. And then once you're up and running on Medicare, we'll get you signed up for the easy pay. So you just pay monthly instead of quarterly. But when you first sign up, you're going to get a quarterly bill from Social Security. Okay. All right. So I'm going to take you through, make it as simple as possible, and we're going to take a look at your options here. But up until this point, we've just really addressed the parts of Medicare, the timelines for signing up, and then associated costs. So now we're going to take a look at your 2 options for filling in those gaps and paying for the services that original Medicare does not cover. So we're going to start jumping into more of the details on your options, on your 2 options. Okay, but before looking at the 2 coverage options, I want to take a look at just kind of what you're on now, because I think understanding this before we go to original Medicare and your 2 options, you're going to see how they're very similar. So right now, you're either on a PPO or an HMO, either through your employer group plan or as an individual plan. So with a PPO, generally, you're going to pay a little bit higher premium. You're going to have a little bit higher expenses, but it gives you the freedom to go to a large network of doctors and hospitals without a lot of the rules, trying to get, you don't have to get a referral generally. There's not a lot in the way of pre-authorizations, and you can also go between states. Okay, so a lot of people will be on PPO and they enjoy that freedom, but you pay a little bit for that freedom. On the HMO, it's a little bit different. In HMO, you generally have lower premium and lower out-of-pocket costs, but you have a primary care physician who directs your care. They're part of a medical group and a local community of providers. And so you'll work within your primary care physician. Generally, you have to get a referral to get to maybe a specialist. There's some pre-authorizations, things like that with an HMO. But I will say, here in California, we have one of the best HMO networks in the country. Anyway, you'll see when we go to your 2 options here that it's very similar. They're just called something different. So it's going to be an option that's like a PPO, and there's going to be an option that's just like the HMO, just to keep it really simple. Okay. All right. So original Medicare. Here you've got what's called Part A and Part B. And again, everyone has to sign up for original Medicare. But again, you've got out-of-pocket costs. You've got deductibles that need to be covered, co-insurance, and there's no maximum out-of-pocket for the year, so it could be pretty expensive. So for those that are on a PPO model, a lot of times they would rather prefer to go to any, most doctors and hospitals and we go between different states and that sort of thing. So original Medicare, they might stay with original Medicare, Part A and Part B, and then add a supplemental plus a Part D plan. And that gives you a comprehensive plan. And that gives you the ability to go to most any doctor, any hospital in the nation that accepts Medicare. And you only have that one out-of-pocket cost for on the medical side of $283. So if you like your PPO, you're going to love a supplemental with original Medicare. So that's a really good option. So let's just take a look at how that works. So with original Medicare, if you get these, stay with original Medicare, get a supplemental to pay for the out-of-pocket costs and a Part D drug plan. When you go to see your provider, you're going to give them your original Medicare card plus your supplemental card. That provider is not going to charge you anything for those services because it's all covered, but they're going to go ahead and bill Medicare. Medicare is going to pay their portion, and then they're going to go ahead and send that bill on, and the balance is going to go to the insurance company. Your only cost is $283 at the beginning of the year, then the insurance covers everything. And the nice thing too about a supplemental plan with original Medicare is that there is no network. Like I said, you can go to any doctor, any hospital in the nation that accepts Medicare, and the insurance company doesn't get involved in your business, meaning that there's no prior authorizations, anything like that. You don't even talk to them. So if Medicare pays it, approves it, then your supplemental will pay. Okay. So then here are some of those costs that it covers. It covers everything that original Medicare does not. So it covers your Part B co-insurance, it covers your 3 pints that they don't cover, it covers your skilled nursing, your Part B excess charges, your Part A deductible, out of pocket, and then also they give you a little bit for travel as well, which we've got a good program for that too. Okay. All right, so let's look now at option 2. Option 2 is your HMO model. Okay, what we just looked at was more like your PPO model. This one is your HMO model. It's an Advantage Plan C. And those choosing a Medicare Advantage Plan C, it's a second way to receive your benefits, and they're covered by the private insurance company. As a broker, we represent all those different plans and companies. But you're going to select a carrier there that's going to cover Part A, Part B, and Part D. So you get everything all in one, just like what you're used to with your current HMO. And like any HMO, you're going to have your primary care physician who's going to direct your care, and that's going to be part of a medical group. And so you're going to have to get prior authorizations and that sort of thing. But again, like I said, you get here in California, we have one of the best HMO networks in the country. Generally, you're going to have little to no premium for this plan here in California, and you're going to get a lot of extra benefits as well. So if you like the HMO model, you're on an HMO now, you're going to love an Advantage plan. If you're on a PPO and you really like to travel a lot and you don't want to worry about networks and that sort of thing, then the supplemental with original Medicare is going to be the best option. But let's look at the HMO now a little bit more. So with the Medicare Part C, like I said, it covers your Part A, your Part B, it covers Part D, or drugs, as well as extra benefits like dental, gym, vision, and over-the-counter benefits and others. Okay, so it gives you a lot of extra benefits. So like I said, it's just kind of what you're used to and what your budget is, because they're both really good options. Okay, so here's your options again. Option 1 is original Medicare, and you add a supplemental plan plus a Part D. Option 2 is an Advantage plan, and that covers Part A, Part B, and your drugs. With both of these plans, you have very little in the way of out-of-pocket costs, and you get a lot of extra benefits here on the Advantage plan. Sometimes you get gym membership here on the supplemental, but 2 really good options, and it just really depends on kind of what your out-of-pocket, what your costs are going to be, what your preferences, lifestyle, and budget as to which route you go, and kind of what you're used to, what your experience in the past has been. Okay. So moving on to Part D. Part D is your drug plan. When you sign up for original Medicare Part A and Part B, you also sign up for Part D at the same time. So either you're going to purchase it separately with a supplemental plan for original Medicare, or you're going to have it included in your Advantage HMO plan. Okay, so either way. So it works just like what you're used to, kind of what you've, your current plan now is that with these, you've got different tiers. You have tier 1, 2, 3, 4, 5, and 6. So tier 1 is preferred drugs, and you're generally going to pay a 0 to $1 for that. Your generic non-preferred, you're going to pay maybe a little bit more. And then for preferred brand, non-formulary brand, and specialty, you're going to pay through a deductible generally. And then after that, you're going to pay either a copay or co-insurance. It works, like I said, it works like what you're used to in your employer group plan or your individual plan. And so that's the way it works. You're not going to see much difference there. You're going to be used to that. This is just a little different way to look at it. But again, you've got a deductible. It's $615 is the standard deductible for 2026, and that adjusts a little bit each year. But it's if you've got generics, generally you're not going to pay through the deductible. It's only for tiers 3 through 5, and you pay through that. Then you pay the copay or co-insurance, and you're going to pay maybe up to 25% there, depending. And then your maximum out of pocket is $2,100. Okay, so if you don't take medications or there's all generics, you may be paying nothing on a monthly basis for medications. It just really depends. Okay. And then, as I mentioned earlier, when you sign up for Original Medicare Part B, and you're making you're in a higher earning income bracket, you're going to pay up for your Part B premium. Well, you're also going to pay up on your Part D as well. And this is also just paid to Social Security as part of your Part B premium. They're going to add this Part D amount as well. So in that last example, if you were paying a higher amount in that first bracket, you'd also pay an additional $14.50 to Social Security every month. And you could have a Part D plan that you're not paying a premium for, or very little, but this is different. This is paid to Social Security. And so whether it's covered in your Advantage plan at no cost or very little on a separate Part D, this is paid to Medicare and is part of your monthly premium there. Okay. All right, so Part 3, we're going to take a look at kind of our services and the services we provide. So why do you need an insurance agent that specializes in Medicare? Well, for a lot of reasons. There's a lot of rules, a lot of deadlines, and so we help you every step of the way. So we educate you, we keep you informed, we handle your annual plan reviews, we help you with updating your medications and taking a look at maybe making recommendations for the next year. We assist you with provider and network search and support, and make sure that everything lines up for you, and take a look at what kind of your annual options are, enrollment change support. So we provide a lot in the way of services, and we've got a great team and everything's systemized, so we don't miss anything. So that's really important. And then this is just so you know, in working with us, how that works is that we have just a 20-minute what we call a discovery call, and there's no charge for our services, so you don't have to worry about that. But we set up a 20-minute call, and that's where we kind of go through and better understand what you've been on, get your general information, doctors, medications, things like that. And then we put together a presentation, personalized presentation, where we do much of what we're doing today. We go through your costs, the basics of Medicare, what those costs would be, the timelines, and then we also go through specific options based on what your needs are that we collected during the discovery call. So that way you can make a good decision, and we can help and get you enrolled, make sure you're enrolled on time. And then after you get your welcome kit, usually a few weeks later, we set up what's called an orientation meeting. And during the orientation meeting, that's when we go through your plan, make sure you know how to access all your benefits. We answer all your questions, and we also provide a very helpful PDF that has all your benefit links right in there with your phone numbers, your ID number. We just make it really super simple. We try and do things that are really high level, so it makes it really simple for you. Okay. All right. And then, as I mentioned at the beginning, like client presentations, we get very specific as far as, plan recommendations and costs. Here, I just wanted to give you kind of a general idea. So that way you kind of know. So if you're going to go with, say, you're going to stay with original Medicare because you want that freedom to go to any doctor, any hospital throughout the nation, then you're going to stay with original Medicare. You're going to add a supplemental plan and a Part D drug plan. And so original Medicare, everyone's going to pay that 202.90. So you're going to pay the 202.90. And say, for example, that you're at that bracket, you're not at a higher bracket. And then you're going to add a supplemental plan, which is going to be another 150 to 250, depending on your age. And it could be zero for your Part D plan, depending if you have any drugs, or medications, and or higher. But ballpark, you're going to be about 350 to 450 all in. That's with your Part B and your supplemental and your Part D. Okay. If you decide you want to go with the Advantage plan, then you only have your 202.90. Generally here in California, you've got zero premium and your drug plan is included. And so you've got a lot of good options there. So those are your two options there. And I hope that helps. We're available here to help you if you would like. We've got you can reach out to me by phone and we can set up a discovery call, have a meeting. You can go to our, for employers and agents, partners, you can go to RileyEBI.com, and for individuals, you can go to our landing page at Riley & Associates, which is MedicareSouthBay.com, and you can set up a call from there as well. Okay, but anyway, thank you for joining us today. I hope you have a really nice weekend, and we appreciate your time. Thanks.